This is a special AHRMM podcast as we speak with session presenters and keynote speakers direct from the show floor at the Music City Center in Nashville for AHRMM. I'm Bill Klaproth. And I'm here with John Freund, President and CEO of Jump Technologies. John, thank you so much for stopping by our podcast booth here at AHRMM. So you did a learning presentation yesterday, maximizing revenue and cost savings in your OR, and you had said something that was very eye-opening. You said 30% of charge capture in an OR suite is missed. You opened people's eyes with that. Tell us about that.
First of all, thanks for having me, and I appreciate being here. An OR is a really hectic place, and there are a lot of things going on, and lots of times there are materials that need to be recorded that is on a package that they rip open and put in a garbage can, and at the end of the procedure, they go back to the garbage can, pull the procedures out, and then try to record everything that was consumed. As you can imagine, sometimes things get missed. Popular inventory auditing companies, OR auditing companies, have told us that about 30% of the charge capture inside of an OR is missed. And it's significant when you think of the fact that if you're a billion-dollar healthcare organization, which sounds like a lot of money, but it's a common number, that's $300 million in missed charges. Your reimbursement is probably 30 cents on the dollar. That's $90 million in cash that could be coming into the hospital if they were able to capture all of the charges that were flowing through the suite.
So any hospital would like to add $90 million, right, to the bottom line. So how do we fix this charge capture issue? Is it point-of-use technology in combination with the nursing staff? How does this work? How can we address this issue?
For sure. I mean, there are a lot of different systems in play between the electronic health record, the ERP system, and nurses are extremely busy. For every hour they spend in the OR suite, they spend as much as 30 minutes documenting cases, chasing down materials, vendors, and the like. So anything we do to add to that workload is going to impede us from being able to capture those charges. Anything we do needs to be a collaborative effort with the nursing staff to make sure that we are actually helping them and reducing the amount of time that they spend documenting cases. We can't have duplicate data entry anywhere. We can't be putting data into a third-party point-of-view system and then having to turn around and key data into our EHR and then key data into our ERP. It's just not going to happen. So supply chain staff working alongside nursing staff to really understand how they're doing things so that we can put in place a point-of-use technology that is enter at one time, update all the back-end systems accordingly, reduce the amount of time they spend documenting cases, make it easier for them to record what's happening inside that suite, and now suddenly you're capturing all the charges you need.
So technology that allows them to be more efficient. You just point, I've got to enter one thing here and one thing there, and I got to remember to do this. So you're saying have a point-of-use technology system where they enter at one time or only, and that definitely would save them time.
So if at the end of a case I can push a button and my EHR is updated with all the materials that were consumed, my implant log was updated with all the implants that were consumed, my inventory was decremented, new orders were generated to refill my inventory, and requisitions were sent to my ERP system so that all of my bill-only implant, trunk stock, consignment inventory was all requisitioned, all with the push of one button at the end of a case. That's something that will motivate nurses to want to use that type of technology.
Right. So how is something like that implemented?
It's, from a clinical standpoint, it needs to, again, remain very simple. The work is on the back end. So integrating with the back end systems and bringing all that data together is where the work is. So that's a little bit more of an IT load. If you have agreement with your nurses as to the workflow that you're going to be implemented, you'll get agreement from IT to put that in place.
I would imagine from the nurse's point of view, they would be in favor of this as well, because if you can minimize their workload or things they have to document, the better, more time with the patient.
Absolutely, and that's what it's all about, which means better outcomes for the patient, which means better reimbursements for the hospital.
Right, so that all works together there. This is really fascinating, John. Is there anything else you'd like to add?
We could go on and talk about this forever, but I think for the time that we've got allocated today, this is great. Happy to engage with anybody on this conversation going forward.
Okay, sounds good. John, thank you so much for your time. We appreciate it.
Again, thanks for having me.
And once again, that's John Freund. And for more education like this, please go to the AHRMM Knowledge Center at ahrmm.org/knowledge-center. Thanks for listening.